every single second of every single day. Your heart is pulling off this incredible feat. But have you ever stopped to think, really think, where does that steady, rhythmic beat actually begin? Well, today we're going to pinpoint the exact location. We're talking about a small but super powerful chamber that is your heart's true starting point. So let's just ask it plain and simple. Where does that spark come from? It's so easy to think of the heart as just, a pump. But there's a very specific spot where the initial impulse for every single beat is born. It's a pretty fascinating question. And by the end of this little tour, you are absolutely going to know the answer. All right, so the answer we're looking for? It's right there in the heart's first chamber. So it's time to meet the right atrium. This is our first stop on this incredible journey. I want you to think of the right atrium as the heart's main receiving dock, okay? It's that upper right chamber, and its main gig is to collect all the oxygen-poor blood after it's made a full trip through your body. This is the crucial first stop before that blood gets shot over to the lungs for a fresh tank of oxygen.
So now we know its job is to basically just receive blood. But how does all that blood get there? It's not just one big pipe. Let's take a look at the main gateways that feed right into this chamber.
So the right atrium has 3 distinct entrances. First up, you've got the superior vena cava. That's bringing in all the blood from your head, your neck, and your arms. Then there's the inferior vena cava, which handles, pretty much everything else from your lower body. And third, the coronary sinus. This one's cool. It brings in the blood that was just used by the heart muscle itself. It is truly the central collection point for your entire system. Okay, so we've covered how blood gets in, but what's this chamber actually look like on the inside? You might be surprised to hear it's not just some simple, smooth-walled box. Not at all. So let's dive in and explore its pretty unique internal structure. And this is where it gets really interesting. See, most of the inner wall is smooth, which totally makes sense, right? It helps the blood flow easily. But there's this little ear-shaped pouch attached to it called the right auricle, and its wall is completely different. It's lined with these comb-like muscle ridges. They're called pectinate muscles, and they actually help the atrium contract with a bit more force to push the blood into the next chamber. It's a pretty brilliant specialized design for a very specific job. But let's be real. Collecting blood and having some interesting internal walls, that is not the right atrium's biggest claim to fame. Not even close. It has another job. A job that's so critical that without it, none of the other stuff would even matter. Because, as vital as receiving all the body's blood is, that is not its most important job. There's another function, kind of like a hidden secret inside this chamber, that is just so much more critical to your survival.